Muted.
One as well. So we are Oscar. We were founded in 2012 by three gentlemen, Mario, Kevin, and Joshua. They all have backgrounds in finance and venture capital. Currently, we have raised over $350 million to date. Our most recent investor has been Alphabet, which is a parent company of Google, which has been very exciting for us. We started in 2012 in New York and New Jersey, and by the second year, by 2014, we had grown to 40,000 members in New York and New Jersey. And this year, we expanded to Texas and California. And so far, as open enrollment has finished, we have over 150,000 members. So that has been a great leap from 40,000 to 150,000. So in New York, we have 22% of the market share. And so our office is headquartered in New York City, but there is a local office here in Los Angeles and another local office in Dallas. As a company, we've also been growing. We have over 450 employees, and we've been very excited to be able to continue to grow at the pace that we've been growing at. So health plans are complicated, and Oscar makes them simple. Our founders really set out to create the type of health insurance experience that they would like for themselves. We are high tech. We do consider ourselves a technology company. We have some great new provider tools that will help you save time and focus on providing great care. We really want to make working with Oscar more seamless, smart, and personal. We're also very high touch. We have a concierge-style member service team that is available 7 days a week. They answer questions, help members navigate the healthcare system, and will even reach out on their behalf. This is helpful for providers because our member service team can answer complex questions for our members without providers needing to figure these answers out. We are working on creating a very high-quality network. We want to share our mission with other providers and hospitals and systems that share our mission of creating better and simple healthcare. And we offer very simple plan designs. We offer free or low-cost access to primary care, mental health visits, and generic drugs with most of our plans. We actually, because of our simple plan design, the White House actually asked us to partner with them on creating a PSA on the Affordable Care Act and health insurance. So I think that really speaks to our mission of simple healthcare. And our members love us. They like our plans. They seem to like our plans much more than they are satisfied with other competitors. They use our tools, which is huge for a health insurance company. 80% of our account holders have a web login and 52% have our mobile app. 33% of our mobile users log in weekly. So that is really great because our members are engaging with us on a level that is usually not seen with healthcare. Normally, members only reach out to their healthcare company when they have billing issues. And so by being able to engage our members, I believe we're getting a much better care experience for members, the health insurance, and with the providers. And also our members recommend us to family and friends. Word of mouth is the #1 way people hear about Oscar, which really speaks to our wonderful customer service. So I'm going to quickly go over our network and coverage area. So we are a licensed healthcare Knox-Keene healthcare plan. We're building a high-quality network for LA and Orange County. We delegated our network to Providence Health Network, and so our network includes Providence of Southern California, UCLA, St. Joseph Hoag is our delegated provider for all of Orange County. We also have Providence St. John's Health Center, Huntington Hospital. We have Henry Mayo Newhall Hospital, and Good Samaritan. So Oscar offers an EPO plan, which is an exclusive provider organization. That is kind of a mix between an HMO and a PPO. It's like an HMO in that our members need to get care in-network. They do not have coverage if they go to an out-of-network provider. However, like a PPO, members do not need to see a primary care physician to get a referral to see a specialist. So we do not need a referral for members to see specialists. We also offer worldwide coverage for members who experience emergencies and urgent care. We also have another vendor called Doctor on Call that I will talk about a little bit later on. That is a great resource for members if they are out of town and have some sort of health issue that is not an emergency. Also, our pharmacy network is covered nationwide. Our pharmacy vendor is CVS Caremark, so members can go to any CVS pharmacy throughout the country and pick up prescriptions. We do carve out some of our behavioral, mental health, and substance abuse providers. So our network partner for that is Value Options. Our network partner for pediatric vision is Davis Vision, and our network partner for pediatric dental is Liberty Dental Plan. All of our providers that are in network through Value Options, Davis Vision, and Liberty Dental Plan have already been loaded into our provider directory online. So any psychologist or pediatric dentist that can be found in our directory is in network through these options. And so there should be no problem with being able to find those type of providers through our directory. I'm going to quickly go over how members experience Oscar, only because it is a much different experience for members to engage with their health care plan. Also, our healthcare plan is really focused on members, so it's important to see the differences. This is our member welcome kit. All members will receive this in the mail once they sign up for one of our plans. It contains their member ID. It contains a really nice, welcoming little letter. It contains stickers, just because we think stickers are fun. And then it has a really nice booklet that really explains the members plan, their coverage, how to get care, and it's very non-overwhelming. So it's a really great way for members to be able to understand their plan without having to read through a very complicated explanation of coverage that is a million pages long and very confusing. This is an example of our member IDs. All of our member ID numbers start with OSC, so it's very easy to see if a member has Oscar or not. Our member ID cards also explain the plan that the member has, and then we'll also show their deductible and what their co-pays or drug prices might be. At the bottom, there's information for providers on where to submit claims, as well as our phone number, our catch-all phone number for providers where they can check benefits, search for other providers, check claims, or submit prior authorization requests. I'm going to quickly go off my presentation to actually go to our website. So this is our provider website, or sorry, this is our member website. One of the great things that we have is this really easy care router. And members, as you can see here by this drop-down, members can search by reason for visit, type of doctor, a specific doctor's name, the drugs that we have that are covered, and the facilities that we have. So in our reason for visit, the really great thing about this is members can be very clinical or they can be very non-clinical. For example, you can start to type in diabetes, And it's going to come up with diabetes type 1, type 2, diabetic foot problems, diabetic heart disease, but you can be also as simple as my tummy hurts. And it's going to come up with suggestions that are related to an upset stomach. So say we go to my throat hurts. Ooh. And we click on sore throat. So it's going to give their members a nice little definition of what their ailment means. It'll give a nice little definition of why they have a sore throat. For example, if you look up a cold, it'll explain how you might have gotten a cold being around other people who are sick. And then it gives some little treatment options, especially for some of these simple common reason visits. And then down here at the bottom, it'll say choose how to get care. And this first option, our doctor on call option, is through our vendor Teladoc. And it is a phone call with a licensed California doctor. We encourage members to use this for really common, simple things. For example, a sore throat might be a great reason that a member can use this. So they would click this button here that says request a call, and they would fill out a really simple profile, and a doctor will call them at the phone number that they provide. They typically call them within 9 minutes. And another really great thing about this is that members can get common prescriptions and refills over the phone. So for something like a sore throat, a member might be able to get medication over the phone if the doctor is able to diagnose them over the phone. Another great example of using the doctor on call is that we can actually, or members can actually send a picture to the doctor. So for the sore throat, the doctor might request that the member snaps a picture of the back of their throat. And if the doctor looked at that picture and saw the white spots on the back of the throat that would be consistent with strep throat, then they could easily diagnose them and them a prescription for strep throat over the phone. We also really encourage members to use this service when they are out of town. This can be a great resource if they are not sure what they should do because they are having some sort of health issue, but it's not quite an emergency, and they can probably get this if they have a simple reason. They can either get it diagnosed over the phone or maybe get advice to go to an emergency or urgent care clinic. The members will also then get either a primary care doctor as one of their ways to get care, or an urgent care clinic or a specialist, depending on the symptoms that they search. If we go to our doctor search, so this type of search is actually going to be specifically for the symptom that they searched. As you can see, it's going to show all the providers around my current location. You can easily go in here and change the location. Members can then filter how they search for the doctors by estimated price, the distance the doctors might be, the years of medical experience the provider has, if they have many Oscar members or not a lot of Oscar members, the languages that the provider speaks, provider's gender. It really gives an experience to the member where they can find a doctor that really suits their needs and is a doctor that they will be comfortable with. As you can see, there is also an estimated price for the providers. This is actually an estimated price on the symptom that was searched, and the estimated prices are taken from our rate sheets as well as from claims data. As you can see, all of the prices are exactly the same right now. That is because we have only been, since we've only been a healthcare plan in California since January 1st, we don't have any claims data for this to change. So these are just taken from the rate sheets that were through the contract. And we do, as it's very clear to see that it is an estimated price. So we, members shouldn't expect that that is the price that they will pay. It's just to give members an idea of what it might pay if they go to see a doctor for their ailment. Another quick thing I wanted to show about the member webpage is that there is an activity timeline, and it shows everything that the member has done in relation to OSCAR. So right here, this is showing that they had a teledoc call with a doctor, and it also shows things like paying your bills, completing health questionnaires. Here is just like a little service announcement of getting their flu shot. So this is just really a great way for members to have access to their timeline of activities. I also think it would be great for members to kind of know when they need to get preventative exams again. It may be hard to remember exactly when you had your last annual checkup, but it would be right here in the timeline, and then they could know exactly when it's been a year and schedule their next checkup. So I'm going to go back to our slideshow. So these are just slides over what I just went over. And we talk a lot about our member website because we like it a lot and think it works really well. But there are other ways members can get a hold of us. They can call us. We have a member concierge service that's available 7 days a week. And members can also email us, and we will return their email within 1 business day. I also did not mention this, but I believe it was on another slide. We do offer all of our members a free Misfit activity tracker. That's kind of a wearable bracelet that's like a Fitbit in that it tracks your steps. And members can track their walking goals through our smartphone app, and then they can actually receive rewards for meeting their walking goals. They can receive up to $1 a day, up to $100 per year, and they receive that $100 on an Amazon gift card. And we really think it's a great way to encourage members to be preventative about their health, and it also helps to engage members with OSCAR. Again, we have really great customer service. Every new OSCAR member receives a welcome call. We resolve 85% of our issues within 1 day, and over 80% of callers talk to a person in under 30 seconds. I'm going to go over some information about how our plans look. So for all of our plans, we offer free preventative care, free unlimited telemedicine, which is the teledoc service that I was referring to, free Misfit activity tracker, which is the step walking activity tracker, and no referrals necessary to see specialists. And our most popular plans also offer free unlimited primary care visits, free unlimited mental health visits, free labs through Quest Diagnostics, and free generic drugs. So our plans were available in California from November 1st to the end of January. They were available through Covered California and available off of Covered California. So our market plans were available on and off exchange, and our Simple and our Simple Plus plans were available off exchange. And as a side note, all of our members, no matter what plan or what tier of plan they have, they still have access to the exact same network. So there is no network restrictions for them, even if they got our simplest plan. So now, the moment you guys have all been waiting for, I'm going to go over our brand new provider website. We're very excited about it. I'm going to, again, go off my slides so that we can look at it in real time. So this is our provider website. You can go to provider.highoscar.com. I wanted to show some things first without even signing in. you can go up here to the top right. There is a resource center. This will connect you to our Oscar doctor and drug search. So you can search for in-network doctors, drugs, and facilities without having to log into your provider website. It also is where you can find our provider manual. As you can see here, there's the California one with a nice little palm tree. Now I'm going to go back to our provider website. I encourage all of our providers to sign up and create an account. You can sign up by clicking here. I would encourage you to do it before you have Oscar members or as soon as possible. It may take a day for us to validate that your TIN and NPI are correct. So it does take a small amount of time for us to verify your account. So that's why we encourage you to do it before you are trying to check eligibility for a member. Also, you can create staff accounts for all of your staff members. I think that's a really great experience because then there isn't one person who knows the password for the website, and when they go out of town, no one can get into the website. This way, everyone can have their own login. So I'm going to log in. So here, you can search for Oscar members. You can search either by their Oscar ID or by their name and birth date. So I'm going to type in our sample one. As you can see here, here is our sample member, appropriately named Oscar. There's information on him, on his member profile, his date of birth, where he lives, his phone number. It also shows if he has family members on his plan. And then right here it's showing if his account is active and when his account was active and when we expect his account to no longer be active. And then you can go down here and see information on his plan. So he has our simple bronze plan. You can click here to get a better plan overview. Here it shows his deductible and out-of-pocket max. I mentioned earlier that we have really simple plan designs, and that is one of the things we did, is that deductibles and out-of-pocket maxes are actually the exact same number. This is just so members have a simpler experience in understanding their plan. So this will fill up with a bright blue color as members continue to pay towards their deductible during the year. You can also go down here and see their costs, their co-pays for everything, and you can toggle it from before deductible to after deductible. As you see, the specialist visit and some other things changed. As you can see here too, this member has 2 free primary care visits for the year. So there's little things like that that will really help you to understand the member's plan. And you can go down here and look at specialist visits as well, benefits and cost share for care at a primary care provider, and you can change it to a specialist office, inpatient hospital, or outpatient hospital. Here's a reminder down at the bottom that services at out-of-network providers are not covered except for emergency or urgent care. And then you can also toggle to our authorization page. This is to help you determine if something requires prior authorization or not. So I pulled some random medical codes so that I can help you demo this. So if we put in this code, this procedure does not require authorization. So you do not need to call in and request prior authorization on this CPT code. But if we put in this code, you can see that it does require authorization. If you click here, you can download the prior authorization request. And to submit a prior authorization request, you will need to call our number at 855-OSCAR-55. Prior authorization is extension 9. And then you can talk to our UM team and fax the requested form. My lovely team would also like to remind all the providers to please send clinical data along with their prior authorization requests, as our team does need clinical data to determine medical necessity. So you can also toggle up here outpatient care to inpatient care. All of our inpatient care does require prior authorization except for childbirth, and you can go continue to medical equipment and play around with that. We do also have a claims section. Our test account does not have any claims, so I'm going to go back to my presentation slides to show you what that will look like. So this is what the claims page would look like if a member had multiple claims. You would be able to see the claim ID, the status, if it was processing, fully covered, denied, and the start of service date. You would also be able to click on it and get more information on our particular claim, see all the information here. So now I'm just going to go over some examples of how to work with us. Again, here's our member ID. I just want to point out that on every member ID, they will have this hioscar.com/help, or you can call 855-OSCAR-55 to check any information, check eligibility, check benefits, anything. We have just a catch-all line, so it's really nice that there's only one phone number to remember. Again, you can confirm eligibility and review benefits for members by logging into our provider website or by calling our phone number. Here is a nice little information about where to submit claims. You can submit paper claims to our PO box in New York. Yes, you should still send it to New York. Also, I would like to point out that even though we are working with St. Joseph, we do handle all of the claims and billing through OSCAR directly. So please send claims to OSCAR. If you would like to submit electronic claims, our electronic payer ID is OSCAR, which is very easy to remember. Our clearinghouses currently are eligible and MDON, so you could get your biller set up with that. And then these are the addresses for claims, for paper claims for our other network vendors, such as Value Options, Davis Vision, Liberty Dental, and CVS Caremark. We are really reinventing our relationships with our providers. Again, we do have local on-the-ground support. That local on-the-ground support is me. We also, our provider app, we actually worked with our providers in New York to create our website. We asked them what they wanted and how they wanted to be able to navigate eligibility claims, prior authorizations through the website. So we're really excited to be able to create a website that providers are excited about and should find very easy to use. You can also go to our website, provider.hioscar.com, and opt in to receive email updates. Since our provider website is very new, we should have some more features that will pop up throughout the year. So if you opt in to receive email updates, you can find out what features we will be bringing to life soon. So I'm going to, Claude, I don't know if you are muted, but I'm gonna unmute you.
Yes, I'm now unmuted. Sorry.
No
Patty is back with me, and she'll take the call to action.
Thank you, Brent, for all the information. So we have a couple of call to action items. First, make sure that your office has signed the Oscar Amendment. Contact your provider relations representative if you haven't done so. Please remember that you are all participating with Oscar. Now, educate your front office schedulers after our answering service as well so that they're aware. Now, inform your biller. If you are currently outsourcing with a billing company, please ensure that they're aware as well. Now, system setups. Make sure your system is set up. If you have a website and you're currently listing the health plans that you accept or are currently participating with, please make sure that you're adding the Oscar health plan as well. Now, be ready to welcome the Oscar patients. Now, we do have here the phone number to Oscar if you have any questions, and that is the 1-855-OSCAR-55.
So, Bryn, we can open to questions.
Yeah, if anyone has any questions, I would recommend that you please write it in. I do have one question that was submitted. If we submit by fax the requested authorization form and then the clinical notes, how will we know if you received them? How fast is the turnaround time for the approval or the denial? I believe if you go to our provider manual, there is better information on our general turnaround time. As far as I know, urgent would be more like 24 hours to 48 hours, and a non-urgent case would probably be closer to 72 hours. If you wanted to make sure that we received the authorization form and the clinical notes, you can always just call that number. Remember that 855-OSCAR-55 extension 9 will get you through to our team. So they are great, and you can call and make sure that they received your authorization form. I have a question. I don't really understand what is the contracted hospital. For St. Joseph, we have all of the St. Joseph facilities and providers. So just as a provider, just continue to use the hospitals, the specialists that you have normally used. If you are worried about a certain...
I'm sorry, Bryn. So in Orange County, you're looking at St. Jude Hospital, St. Joseph, Mission of Laguna Beach, and Mission of Mission Viejo, and Hoag, Irvine, Hoag Newport.
Yes. And also you can always go to our provider search and search by facilities to see if you really wanted to check on a facility and make sure it was in network. I have another question. If we are not contracted with the exchange, are we able to see Oscar patients that signed up with an Oscar exchange plan? Yes, you should be able to see all of our Oscar patients. It doesn't matter if they are on exchange or off exchange. I have a question about a fee schedule. That would be a really great question to go to your provider relations rep at St. Joseph or contracting. Oh, and then I have a question, and Claude, I don't know, this might be something that you have an update on. One of the doctor's offices is saying that they send our electronic claims through Office Ally, which we are aware of, and I was just wondering, Claude, if you know if that had been set up yet.
You know, that's a good reminder for me to follow up with them. I mean, we are trying. We understand that most of our providers are using Office Ally, and it is our intent to make sure to facilitate that, to use Office Ally to submit to Oscar. I will follow up and get back to everybody to make sure to make the announcement. But I don't have any news.
Okay. We are, so again, we are aware that most of St. Joseph has been using Office Ally, and I know we have been working on making sure that our clearinghouses can work with Office Ally. I don't see any more questions coming in. If anyone has any more, now would be a good time to write them in. I will also be sending out an email to everyone after this with this deck as well as our provider welcome letter and a little one-sheet page on quick things on working with Oscar. I have also been recording this, and we'll send that out to everyone as well, in case they would like to use this to view or have other people in their offices view at their leisure. Oh, and then also, I know I've talked about our provider website nonstop, but this provider email is california_provider@highoscar.com. That is our delegated provider email address for all of our California providers. I actually manage that email address, so if you email that, you will be getting through to me. And when I send out the follow-up email, I will be sending that email from this address, and it should be linked to the webinar as well. So if you have any questions throughout any process of getting implemented with Oscar, you can use this email address. And I have one more question I see coming in. It has a question. You said the deductible and the out-of-pocket max are the same. Does that mean the patient pays in full until that deductible out-of-pocket is met? It really depends on the plan, and you can see that when you look up a member through the provider website and see the prices that they should pay for everything. We do like to throw in a lot of free things. That's why we have the free preventative care and free primary care visits and free mental health visits for some of our plans. So we really are trying to make sure that members don't have to pay full price until they meet that deductible, but that is how some of the plans might be if they're seeing a lot of specialists. So I would say it really just depends on the member's plan. And then I have another question. To follow up on claims or authorizations, do doctor offices call Oscar directly? Yes, especially for authorizations, you can call Oscar 55 extension 9 to reach our utilization management team. And they are the ones who handle all our prior authorizations. For claims, you can go through the provider website and see the status of your claims, but if there are any other questions, you can always call Oscar 55. Or if you have other questions and Oscar 55 is not helping you, you can always send me an email and I can help direct you to the correct person. One more question. Are members assigned to a primary care provider, or can they see any family physician in the panel? So no, our members are not assigned to a primary care provider, so they can see any primary care provider that they want to. Again, we do not require referrals, so members do not need to see a primary care provider to get a referral to see a specialist. They can just go see specialists when they feel they need to. Okay, last chance for anyone to write in any more questions. Oh, spoke too soon. So would there be any time that authorization is needed? Yes, there are times. I believe I was showing you that we have a tool on the provider website where you can check CPT codes and see if we require prior authorization or not. And you can also, I'll be sending out our provider welcome letter, which has like a little list of things that generally require prior authorization. Okay, if there are no more questions, then I will give you back another 10 minutes of your day. Thank you all for taking the time out of your day to learn more about Oscar. We're very excited to be working with St. Joseph Hogue Very excited to have you in the network and excited that we can be learning more about you as you are learning more about us. And I will be, again, sending out a follow-up email with a lot of information, and feel free to email me at any time with any questions you may have. Thank you so much.